100% of those baby boomers are going to be 65 or over by 2030. In fact, we have 10,000 people leaving the workforce a day, retiring on the back end of that. Now, what's it mean when they leave the workforce? What's it mean when we age? We all know we need more care when we get older. It's just a fact. So the concern I have is that the number of care workers that we're going to have is drastically reducing because these people are retiring, they're moving on. So we've got to get a way of being more efficient to use the care workers that we have to actually apply care to these elder that are going to need more and more care, right? So this is a place where we've got to find a way, and hopefully we do this, because we got to find a way for your children and these elder folks to communicate effectively, right? To actually be able to engage with each other. And if we find that way, maybe I'll get more than just a request for money occasionally from my kids as well. But this is extremely important. That's item number one. Item number two, as we walk up the chart, is statistically, 59% of all those in category Gen Y, they'll actually change care providers. They'll move from one pharmacy to the next purely by online access. If I can't get something online, I'll go somewhere else. I don't want to engage a human. I don't want to have to talk to someone. I don't want to make a phone call. I want a good online experience. Other industries have trained them to expect this. If you think about it, in a travel agency, getting here, I remember in my former career traveling, I had paper tickets, I had Thomas guides, I had to get in a day early so I could get to the place. Nowadays, I use 5 apps to travel. I can get from the airport, I can get to the airport, on a plane, off the plane, to the hotel or the location, and I can do it all in the same day. In my past life, I used to go in the day early to make sure I knew exactly where the location was and know I could get there effectively. Don't have to do that anymore. So think about those kinds of experiences. We've got to bring those and pull those into healthcare so we're engaging the audiences. And then the last one I'll talk about is this Gen Z population. Everybody heard of the gig economy, right? So the gig economy is very interesting, but it's also starting to apply to healthcare now. These children, I don't call them children, they're growing up and getting older, but these folks in the Gen Z category, they put together their healthcare much like they get a ride from point A to point B. They call Uber, they'll actually go to any service and actually tether together their care. Many of them don't even have a primary care physician, which is the centerpin, frankly, of what we're trying to do in care delivery. So it's very interesting. We're going to have to live with that experience.